Hey, it's Dr. Karen with this week's hot topic. Make sure you like this video, subscribe to our YouTube channel, and follow us on social media so you never miss another hot topic. So this week, I want to talk to you about a sleep study. Now, I've mentioned this before in a ton of other hot topics, and it's also something that I do as part of my sleep program in the office, but I wanted to explain exactly what a traditional sleep study is. So just an edit, this is not how I do sleep studies, so I have a special device called a circle that's convenient at home. But again, we can talk about that more later, but let's just shift to more of a traditional sleep study that most people have. So when a sleep study has been ordered, it's because there's a concern that you might have a sleep disorder that's affecting your health. So what exactly is this sleep study? So it's a non-invasive overnight exam that allows the doctors to monitor while you sleep to see what's happening in your brain as well as the rest of your body. So for this test, you go to a sleep lab that is set up for overnight stays. It's usually in a hospital or a sleep center. And while you sleep, an EEG monitors the sleep stages and the cycles of REM and non-REM throughout the sleep to identify those possible disruptions in the patterns of your sleep. So a sleep study measures things such as eye movements, oxygen levels of your blood through a sensor, so there's no needles involved, heart and breathing rates, snoring, and body movements. Now just remember, the main goal of this study is to obtain data which will help your doctor determine the next steps in your care. So the most common types of sleep problem is sleep apnea, which is a disorder in which your breathing is irregular at night. So this causes stress in your heart, which can lead to low oxygen levels, hypertension or high blood pressure, and heart rhythm problems. So it also can lead to an increased plaque buildup in your arteries, the heart and the brain, and it is associated with a higher risk of stroke and heart attack. So if you have this, you want to make sure you actually get a sleep study. So there's different types of sleep studies. So sleep studies just kind of collect different data. So there's different available depending on one's symptoms and the sleep disorder that the doctor potentially thinks that the patient might have. So this first one is polysomnography. So in polysomnography, a sleep technician monitors a patient who stays overnight in a clinic. So the variety of functions are measured throughout the night. So it includes eye movements, brain and muscle activity, respiratory effort and airflow, blood oxygen levels, body positioning, movements, snoring, and heart rate. So then there's also a multiple sleep latency test. So this one just measures how quickly someone can actually fall asleep and how quickly they enter into the REM sleep during daytime naps. So this test is primarily used to diagnose excessive daytime sleepiness that can be due to narcolepsy or an unknown cause like idiopathic hyperinsomnia, which I've also done a hot topic about. The third one is a Cpap titration. So Cpap is a common treatment for sleep apnea. So in this particular test, the technologist determines the amount of air pressure that the patient needs for their Cpap so that the machine can be properly programmed for you to use at home and every night. Usually it does require a couple sleep studies. So when the sleep apnea is strongly suspected, a split sleep study is usually an option. So in this split sleep study, this polysomnography is used to diagnose sleep apnea during the first half of the night, and then the Cpap titration is performed during the second half of the night. And then lastly, you have the home sleep apnea test, which this one just collects data about your breathing, heart rate, and other variabilities overnight. However, when it's compared to this polysomnography, home testing provides less information, and the process is not really seen by technologists, so it may not necessarily be accurate. So what can you diagnose with a sleep study? So a sleep study is used to diagnose a lot of disorders, but mainly in particular insomnia, sleep apnea, restless leg syndrome, narcolepsy, limb movement disorder, sleepwalking, sleep talking, REM sleep behavior disorder, and that's pretty much what most people cover as far as why you would have a sleep study. Again, there's a lot of taboo around a sleep study. Some people are like, oh, you're not going to get much sleep when you do this because people are staring at you. So there's a lot of different reasons why you have to have a sleep study, but it's super important if you feel like there's an underlying cause of something, especially if you're not getting really good sleep, be a really good reason to take a sleep study. So this hopefully will just be like a really good intro of what you can expect, of why you would would have to take a sleep study, and all the things that it can help you. But again, it's a diagnostic test. So once you have it, there's so much more information that you can use, and you and your doctor can actually move forward as far as your health and figure out how to make you the healthiest and happiest person you are. All right, that's all I have for you guys this week. I will see you guys next time.